A very good evening, all. I'm Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 155 million cases of COVID-19, with now more than 3 million deaths. India, home to many of our viewers, is continuing to see the coronavirus ravaging the nation. Hospitals are overwhelmed and out of crucial supplies such as PPE, oxygen, plasma, and much more. India has so far reported more than 20 million COVID-19 cases and more than 226,000 deaths. The second wave has also reintroduced partial lockdowns in many of India's biggest cities, especially the capital, New Delhi. So again, we hope you and your family, friends back home are staying safe and healthy, and a salute to the frontline healthcare workers in India who are putting themselves at risk. Here in the United States, we are at more than 32 million cases of coronavirus and at least 579,000 deaths. The rate of cases and deaths is steadily going downwards, but health officials are cautioning that the variants of the coronavirus, along with anti-vaxxers, could be damaging in the future. So again, if you haven't gotten your vaccination, please do so. Visit cdc.gov for more information on finding a vaccine location and an appointment. We have tonight lots more on COVID-19 crisis in India and the improvements here in the United States. So let's begin tonight's episode taking a look at the headlines. India reports highest ever surge in COVID-19 cases and deaths. Dr. Suresh Reddy, Chicago. Singer Shibani Kashyap addresses COVID-19 crisis in India, New Delhi, India. Hackensack Meridian Health donates oxygen PPE supplies to India, COVID-19 pandemic relief, New Jersey. Time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. Let's begin by taking a look at the coronavirus pandemic updates and measures. India today reported a record of more than 412,000 new COVID-19 cases and a single-day record of more than 3,980 deaths. This was the 9th consecutive day that the number of COVID-19 deaths there surpassed 3,000. Health officials and experts are saying that these numbers are a huge undercount and the devastation is more than one can imagine. Hospitals continue to be overwhelmed and are unable to help all sick patients, with many dying on the streets, not in the hospitals. Meanwhile, cases and deaths in the United States continue to decline with the push to vaccinate anti-vaxxers as well as underserved communities across the nation. This is happening while several states are looking hopeful towards reopening this month. But experts say not to let your guard down and continue wearing a mask. On this and India surge, we spoke earlier today with Dr. Suresh Reddy from API, the American Association of Physicians of Indian Origin. Dr. Reddy is also the president of Association of Multi-Ethnic Physicians. Here is what he shared with us. My first question to you has to deal with our homeland, India, and all that's happening there. Today, India reported its highest ever recorded surge of cases, looking at more than 412,000 cases in a day. And the death toll just for the day was 3,980, nearly 4,000 deaths. Experts are saying this is still an undercount. So my question to you is, how are you observing this surge in India and how bad could this be for the rest of the world?
I'm part of an organization called API. I'm a past president and also another president of American Association of Multi-Ethnic Physicians.
Right.
And when I was the president last year, that's when the COVID hit us. We spent so much time on COVID, like doing almost 250 webinars with 250 speakers from all over the world. It's more like hitting a moving target while flying. So nobody knew like what to expect. And I thought in India, We thought the wave is over because few months ago there was almost zero deaths, and the infection rate has gone significantly down. And we thought India kind of survived COVID far ahead of many other countries in the world. But it hit the second wave. The second wave is lethal and very virulent. It's affecting the young people, it's affecting people in the 30s, 20s, and the death is usually happening within 1 to 2 weeks. Before, it used to be a little bit slower process, and it's affecting so bad, so many deaths. We are really worried. The second wave in India is so virulent and lethal. Usually, the COVID usually affects a little bit older age group, and usually the symptoms start of 1 week and goes to second week, and it becomes serious after third or fourth weeks. But this wave is hitting the young population very hard, in like who are in low 20s, 30s, 40s, and the symptoms are starting in 3 to 5 days, and deaths are happening within a period of 2 weeks. This is a very lethal virus, lethal strain, and it's the prediction is almost there will be almost 1 million deaths in India soon. It will cross the 1 million mark.
Right. Doctor, do you think that's still an undercount of the deaths that could be possible?
Oh, definitely. There is we can easily add another 2 to 3 times of the deaths reported. Part of the reason is especially in rural areas and also in the hospitals, they are overburdened, and they are not able to report the accurate number. I think there are at least 2 to 3 times, even times more deaths than that's what's happening.
Wow. And doctor, I'm sure you are connected with several Indian physicians in India. We're hearing horrific stories of hospitals, of ambulances, of everything being run out. What are you hearing? What do you know so far?
I think it's the healthcare system is not able to cope up with the demand. So many deaths happening, so many infections happening, so many admissions. There is shortage of beds, there is shortage of oxygen, there is shortage of medications. There is shortage at every level. It's so hard to cater for so many millions of people. And the government is doing the best they can, but again, when people get frantic, they try to get whatever they can and try to rush for it, and especially for asymptomatic patients or some of the mildly symptomatic patients. They are rushing for treatment, they are rushing for admission. Even though there are some patients who does not need admission, they are pushing themselves to get admitted. So there is already existing overburdening on the system, and people in frantic, they are becoming causing more and more burden on the system.
CDC released some guidelines for vaccinated people. President Biden also announced those guidelines for vaccinated people where they could be unmasked outside in certain conditions. My question to you is it too early for them to say this? And do you believe we should still be masking ourselves no matter where we're going?
I think that's a release by CDC. We should follow whatever the CDC guidelines are. And it's a relatively safe. It's not 100% safe, but we cannot live in a way of constant fear. But again, we have to be very cautious and judicious. The reason it was said that if you wear a mask and if you are an outdoor and if with a limited group of people who you already know, that means that the chances of infection are less, but doesn't mean it's zero. So you still have to be cautious. If anybody has symptoms of fever or cough, you have to be careful and stay away from them. And so you still have to maintain precautions.
Right. Doctor, what are the chances of a vaccinated person getting COVID-19?
There is very, very, very minimal chance. There is a chance because there are multiple strains going on, but the chances are extremely low.
All right. When we're talking about the vaccination program right now, I have some questions on the vaccines right now, doctor. Are you happy with the progress that the vaccination program has made so far? Or do you think we are still limiting ourselves with the people we're trying to reach with the vaccines in this country?
Because this was done on a record scale. Within a year, we were able to produce, even less than a year, we were able to produce a vaccine. That means we don't know the long-term effect. We don't know what happens 5 years from now, 10 years from now. So these are not time tested. These are laboratory tested. So we have to be careful when we give them. So that's why they are doing in a stage phase manner, and you have to do that and make sure. First, it started with first responders, the physicians, the police, the fire. Then they opened up to the seniors. Then they opened up because we have to make sure we have enough vaccines. At the same time, we have to make sure no long-term complications come from these vaccines.
Well, we continue to reflect on the devastation caused by the coronavirus in India and resources and pandemic relief that is being sent back home. India has literally ran out of oxygen and people are dying in thousands in the country, and hospitals have also reached their maximum capacity. Help is being sent from all across the world to India so that the worst outbreak of the coronavirus pandemic can be contained. On sending this help, New Jersey's largest health network, in partnership with Health Innovations Unlimited and several New Jersey physicians, have come together to alleviate COVID-19's devastating impact in India. Earlier today in Edison, New Jersey, the Hackensack Meridian Health announced that it is donating 400,000 pieces of PPE, personal protective equipment, along with oxygen concentrators, reusable gowns, and hand sanitizer to support COVID-19 pandemic relief efforts in India. These crucial supplies, especially the oxygen, are being sent to some of India's most affected cities: New Delhi, Mumbai, Bangalore, Lucknow, Ahmedabad, and Kolkata. ITV Gold spoke to key individuals behind this effort from the Hackensack Meridian Health. Here is the story.
My name is Charles Riccardi. I'm the general manager for Hackensack Meridian Health on the durable medical equipment side. Going into the spring and summer of last year, we were preparing for a resurge in COVID. So we were stocking up on 5-liter oxygen concentrators and personal protective equipment. Luckily, with the increased advancement in healthcare, along with the COVID-19 vaccine being rolled out, the surge that we were preparing for wasn't as bad as what we predicted. That left us with a surplus of oxygen concentrators. So Dr. Varma reached out to us, told us about what was going on in India. We just so happened to have oxygen concentrators on hand. And in this case, we're able to donate 100 to Oxygen for India. Hopefully this will help with the crisis going on in India. That's our goal. Sure, so these are what we're preparing today. It's the 5-liter oxygen concentrators along with a patient kit. This is a startup kit. It contains oxygen tubing, adult nasal cannulas, along with additional tubing and no smoking signs. Each kit contains 3 cannulas, so that should be good for 3 patients when it gets over to India. So at least 3 patients can use these concentrators, and then we can send more tubing as needed. Sending over CPAP machines to India. These are the units that we're preparing to send over.
Hi, I'm Ken Shapiro. I'm the warehouse manager here at Hackensack Meridian, and proud to be helping out delivering oxygen for India. It's a great thing that we can do and help out the people who are struggling right now. So what I do here is, this is a pallet of our oxygen concentrators. What I'm doing is getting them all on a pallet, height-wise, so we can ship it Federal Express over to India. I shrink wrap it, we put the labels on, ready to go, and hopefully everybody will have this stuff within a week or so. So it's just a proud moment for me to be able to help out.
Lauren, I'm a respiratory therapist. I work for Hackensack Meridian at home. And today what we're doing is we're gathering up concentrators to donate to India for everything that's going on with COVID right now. So basically what an oxygen concentrator is it's right here, it's right beside me. It makes its own oxygen, so you don't have to worry about refilling any of the oxygen like an oxygen tank. So this is going to be really important for a lot of the patients out there, because you could just plug this into the wall and then it will actually make its own oxygen from regular room air. Right now, these patients with COVID, they are showing a big decrease in their oxygen saturations. So all of this oxygen that we're donating today, along with the oxygen supplies, is really going to help increase their oxygen saturation, and that way they can feel less of the symptoms of COVID, and they'll be able to not feel shortness of breath like they can when you have a decrease in oxygen. We're really grateful to be able to be a part of everything that we're doing today, donating, and it does feel good to be able to, be a part of something that is just wonderful to be able, to be a part of it.
My name is Charles Riccardi, CharlesRiccardi. I'm with Hackensack Meridian Health, DME. Today we're here because Hackensack Meridian Health is donating 100 oxygen concentrators to Oxygen for India. Initially going into the second phase of the pandemic, summer of last year, we started to stock up on oxygen concentrators so that we were prepared going into the fall so that we had an adequate stock on hand for our patients. Luckily, with advancements in treatment, along with the COVID-19 vaccine being rolled out, the second surge that we were anticipating wasn't as bad as what we thought. That left us with a little bit of an overstock of oxygen concentrators. So Dr. Varma reached out to us with her charity called Oxygen for India, seeing if we could help. And we did have a couple hundred spare concentrators on hand, and we were able to donate 100 concentrators to her charity to help over the patients in India that desperately need these oxygen concentrators. So we're here today palletizing them, getting all the customs paperwork together on the pallets, shrink wrapping the pallets, and preparing them for FedEx to be picked up hopefully later this afternoon. That's our goal. Yes, absolutely. So this really helps. It really makes us feel good because we're here. It speaks for the mission of Hackensack Meridian Health to keep doing better. We had these concentrators. They were sitting in a storage unit. We heard about what was going on in India. It made the most sense to donate them so that people that desperately need them could use them, and that's our goal. We've been working for about 2 weeks on preparing everything to get this out, and it really means a lot to the team here to be able to help. They've been putting in a lot of extra hours getting everything together, but we're really hoping when these land in India that they're able to help patients and multiple patients too, that one patient can use them, recover, and then the next patient can use them, so that continues to help until this pandemic is over.
It's time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Diti Lama, and this is Vision of Asia South Asian News segment. As India reports its highest new coronavirus cases and sets a daily record of deaths, eyes continue to be on the need for a mass vaccination program, which has been heavily impacted by shortages in doses of the COVID-19 vaccine. India is not able to vaccinate as fast as the coronavirus ravages the country. The second wave of infections exploding everywhere in India has led to lockdowns in some of the states, but experts fear that this news comes a little too late as hospitals continue to be out of space, PPE supplies, and most importantly, oxygen. On this, several South Asian artists and celebrities are now supporting charities and non-profits that are bringing pandemic relief to India's most underserved communities and are focused heavily on providing food and oxygen for India. Discussing these organizations and the impact of COVID-19 crisis in New Delhi, we spoke with popular singer Shibani Kashyap. She's a multi-talented Indian playback and pop singer, along with being a music composer and a live performer. Shibani is currently putting all her efforts in providing much-needed relief to Indians struggling with the coronavirus. Here's a part of our conversation with singer Shibani Kashyap on the worst surge of COVID in India. Starting this conversation with you, Shibani, I have to ask you, currently you are in New Delhi in India, and you did travel across several states right before that. How are you and your family doing right now?
Well, by the grace of God, we're all safe, we're good, but we're absolutely not stepping out at all. I mean, there is a lockdown here. There is absolutely an official lockdown, but we're just not stepping out, not even to meet a friend or whatever, because it's really, the cases have been rising up very rapidly, and this time it's really, the second wave is very dangerous. It's very risky. It's claimed many lives. and it's becoming fatal. So we really, there's a fear factor, there's a fear psychosis all over India, and it is something to be really worried about right now. India is in a bad shape.
So right now, everyone's staying inside and you don't see that many people out on the streets. Can you tell me what you have heard about what's happening with these patients that are getting sick? You know, the hospitals are getting full. What have you heard or seen?
So, every day there are, we've got lots of various groups of friends, and, in our groups, people keep asking for, we need oxygen, or we need a bed, we need a hospital, we need an ICU bed, we need an oxygen cylinder, and it's happening to the inner circle. So it's happening with friends, with relatives, and it's so distressing. And I can't believe that the capital city would actually, we would come to this state that we don't have medical facilities enough to provide to patients. So it's very dismal. The situation is very dismal, but one good thing which is emerging is people are really, the charities and people and the civil organizations, they're really doing a lot for each other. So we all of us, we're trying to help friends to get beds, to get a hospital, to get an oxygen cylinder. A friend of mine has just started free oxygen refilling seva, which is like, if your oxygen cylinder has finished and you need oxygen, so they refill it for free. So these kind of things are happening, which people are doing, and that is the admirable thing.
Yeah, but it's so sad. We see people dying on the streets literally every single day that are not being able to be admitted, and the underserved community, the people that are on the poverty line are really suffering because the hospitals are just not open. I have to ask you, Shibani.
Not just the poverty line.
Yes.
This, I'm sorry to say, but this virus, and at the moment in India, this virus is claiming the lives of the richest of the rich, who are also helpless at the moment. Even they are not getting facilities. They're not getting hospitals. They are not getting oxygen. They are not getting ICU beds because they're all full. Especially, in the capital city. I don't know about the other cities, but yes, I do believe that Mumbai is doing better. The cases have gone down considerably. So, but this city is in a very bad shape.
Right. Shibani, who do you sort of blame this surge of cases on? The international media is currently very critical of Prime Minister Narendra Modi and the fact that he let some Hindu festivals go on with millions of people attending, as well as election rallies. As an Indian citizen, how does it feel to see that happen? And also, who is to be blamed for this?
So to be honest with you, somewhere we the people are also to be blamed. I'm considering myself to be a part of the people because yes, we constitute I would say the population of this country, and we as people, we should have taken the responsibility of going out there, wearing masks, keeping our social distancing on, and all of that. I think somewhere everyone got carried away. When festivals were happening, there was so much of shopping happening in marketplaces. People would just keep shedding their masks or just wear it down to their chin. It was just more like a namesake mask,
Right.
So on one hand, the police was patrolling the streets and even fining people on not wearing masks. But how much can they follow them? How much can they monitor them?
Right.
They can't babysit everybody. So if everyone had been responsible, everyone had said, no, until this pandemic, until everyone is vaccinated, or at least a large part of the population is vaccinated, let us not have these functions. Let's not congregate. Let's not go to marketplaces. Let's not go clubbing. In places like Goa, the clubs were on, parties were on. Even now that is in lockdown. So I think somewhere everyone is to be blamed. We the people and the government and everyone. Right. So I think everyone should have taken cognizance.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook at ITVGold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.